All right, here we go. I'm living in the middle in a place called Cotswolds. It's quite lovely. It's like lots of woods and it's like
Yeah, I know the
a
Cotswolds well.
yeah, yeah.
Yeah,
It's nice. I wanted a bubble from reality and I'm totally fine with that. And I live in a bubble
sounds
and I'm
good.
totally cool with that. Um, right, yeah, well thank you so much. This is just going to be sort of just a quick like session about rapid fire, almost just three questions of like Q&A around like
Sure.
as a dog behavioralist. It's really great that I have you in the room because as a vet, I really wish like I had you in my ear whenever I'm posed with questions. But I guess the first question would be, as a dog behavioralist, what's the number one question that you get from owners, and what is your answer to that number one question, if there is one?
Sure. So I'm actually a veterinary behaviorist. So I'm also a vet, and that changes a little bit the caseload that I see, I guess. And one, I would say the number one presenting scenario or complaint would be aggressive behaviors in dogs, and then also anxious behaviors. So those two are, and a variety of different anxious behaviors. So it could be separation anxiety, noise phobias, generalized anxiety disorders, and they can then sometimes result in aggressive behaviors. But yeah, those would be the sort of two main categories, I'd say.
It might be hard to sort of condense things down. I mean, as you know, dog aggression has been a huge issue here in the UK. Well, it's been very like visual and media, anyways, and then
Yeah.
certainly an issue in certain places, even resulting in deaths. Although that's I guess that's probably something completely different to what that type of aggression is probably different to what your typical client might have issues with. But what's the most common type of aggression that you see, and what are your top tips to help to start the remedy of that?
Yeah, so I mean, aggressive behaviors come in all kinds of forms and for various different reasons. And, one of my jobs is to try and understand what the reason is for it, because only then can you address the root cause of it. But I'd say as a veterinary behaviorist, pain is a big factor. So painful conditions, especially in older dogs, but also in younger dogs. We're seeing sort of osteoarthritic and musculoskeletal pain from a much younger age. So pain is definitely quite high up there. I've had recently a spate of child-directed aggressive behaviors, which unfortunately are very common. And that's often around resources or owners not being able to interpret dog body language very well. It can also be, so I recently had a child who the dog was really worried about once the child started kind of crawling and moving around.
Mm.
So it's that kind of, I guess, presentation of movement and of just being a toddler, I think that some dogs find very disconcerting. So it's really all about safety management. That's the first piece in those cases. And then trying to understand what the root cause is. So often that will involve medical workup as well, trying to understand emotional state, trying to see whether aggressive behaviors are coming from an anxiety disorder, so fear-related aggressive behaviors. So I'd say they would probably be the three most common. So pain, fear related, and then kind of resource related and social anxiety type situations. And that can be both towards people or other dogs or other animals as well. But yeah, those would be my three.
That's interesting. I suppose like when we have I guess when we become arthritic, maybe we become grumpy and we don't even know it. Like I think that takes its toll on us much more than we realize. So do you
Yeah.
find like with those animals, if you can diagnose what the source of pain is, like a lot, like for example, one more obvious one is ear pain, right? If they have ear infections, that's like, and they're very
Oh
head
yeah.
shy. And then when you treat for that, they're a different dog. Do you find the same
Right.
with arthritis? Like if you treat with non-steroidals, do you actually find an improvement in behavior if you address the arthritis?
Yeah, and I think there's a little bit of a difference between sort of acute pain that could be from an ear disease, although that can turn into chronic pain, obviously, as well, and perhaps musculoskeletal pain, which can be a little bit more difficult to treat, and it really needs a multimodal approach. So I think as long as you have owners that are on board and that are willing to go down the route of addressing pain in not just one way, so not just with non-steroidals, but in a multitude of different ways, then yeah, absolutely, we can often get a really good outcome. Having said that, though, I also have a number of cases where we have used just non-steroidals and it's really helped, not on its own, but together with kind of behavioral management, behavior modification, perhaps some psychopharmaceuticals. And then, sort of the non-steroidals, that's made a really big difference as a, you know, multimodal approach. So yeah, I have actually one really interesting case, a French bulldog who has atopic dermatitis, of course, and getting the dermatitis under control was also a major contributing factor. So every time he had a flare up, mainly on his belly, he would start to become aggressive. So again, it's that sort of tailoring it to the individual patient, treating what the underlying cause is. But yeah, I do feel that that's potentially the easiest form of aggression to treat, because if you have a medical underlying cause, you can treat it. And that's not always the case quite so easily in the other instances, I guess.
That's interesting. I think as vets, we need to stand back and look at things more big picture. Yeah. And I think that workup is so important that I think, to be honest, when you're stuck in 10 to 15-minute consultations, you just kind of like, you just want to move on and just chuck some drugs at them, or say, you know, make an appointment and someone else will take up that query, because we're dealing with something else at the moment. But yeah, that's a good point. I get a lot of questions about not about aggression, but about like play biting, especially with puppies when they get a new puppy. You know, a lot of like, oh, you know, can you clip their nails because they're so sharp, and their little needle-like teeth are hurting me, like they're constantly biting. And they say, you know, what will this stop? What is your answer to that?
So this is one of my favorite topics. So we also get asked this quite a lot. And play biting or puppy biting can have so many different causes. So again, it's a little bit about sort of delving into why that's happening. Most obvious thing is explorative behaviors, you know, especially those breeds that are very orally motivated anyway. So think retrievers, they explore their environment with their mouths, with their teeth. And then in that kind of puppy stage, they're doing that much more so. So in that case, it would be about redirecting those orally motivated behaviors onto something else, right? Something appropriate, a Kong or a toy or something else that they can do. But sometimes that play biting can also be communication. So it can either be a communication that the dog is getting overly excited and overly aroused, and it actually needs a little bit of calm time, or it can be a communication that actually that interaction isn't suitable, or that the puppy doesn't like the type of interaction. So we often see puppies where perhaps the kids are particularly boisterous, you know, and they're kind of carrying the puppies around, and then they go to that biting as a way of trying to stop that interaction or increase distance. So, and then of course we've got things like teething and, you know, perhaps dental pain. So there are a number of different things that can be, and it's not you know, a question of one answer sort of fits all. It's a little bit about diving into why the puppy might be doing that. But yeah, that was quite a long answer.
In the case of redirecting, right, with the Kong, how do you redirect? Like, how does that, like, literally, how do you do that?
So one thing is being prepared. So that's, I think, sometimes where people fall short, because then the puppy's in that kind of biting behavior and you haven't got something to easily grab and redirect with. So I always say, you know, make up a couple of Kongs in the morning or the night before and have them ready in the fridge to go. And then, you know, I have my clients have like little jars of treats all over the place that they can easily just pop open and then kind of toss away. So if, let's say you've got a Kong in the fridge and you've got a little jar of treats in the living space somewhere, if the puppy starts biting, grab a handful of the treats and toss away from you. So throw away to create distance, and then go to the fridge, get the Kong out, and then give the Kong to the puppy. And that could be in a quiet place, let's say in a crate, if the puppy likes a crate, or behind a pen, if that's an area that they have, so that we've got some physical separation and then something else for the puppy to do in that moment. But it's all about being prepared, unfortunately.
That's interesting. The physical separation. Sometimes we have to do that to get ourselves out of a situation mentally as well.
Right.
Physically step back and then go back into it. Yeah.
Yeah.
That's so helpful. One final question. I'm not even sure if this is a behavioral problem, but like, if you're introducing a dog to a new food, and you have those clients that say they're not going to eat it, literally they'll starve to death, therefore I'm not going to do this, and they need the food, or ideally have the food for weight loss purposes or medical purposes. You know, is that a behavioral thing, or is there anything you can do about that?
Yeah, I'd say it was definitely a behavioral thing. So obviously food preferences can form over time, and they can form from a young age. So it might be a little bit difficult initially, but sometimes I find it's the way that we feed them. So dogs are scavengers, you know, that we know that they enjoy kind of scavenging and snuffling for food. So sometimes just placing that food in kind of a boring bowl is maybe a little bit, doesn't kind of motivate and encourage them. So if you are changing over, I'd use something that was a fun thing at the same time. So a food puzzle maze, or a food puzzle toy, or maybe a Kong, or a licky mat if it's wet food, or a snuffle mat. Snuffle mat's a great thing to combine the sniffing element with the feeding, and just try and change things up a little bit and make it fun. I've had clients that come to me that state categorically the dog will not eat this particular food and it won't eat it from a bowl. And then they come into the consult room and we use the same food and we just present it in a slightly different way. And all of a sudden the dog's like, oh, there's an added element of motivation of kind of doing something for the food. So that contra freeloading aspect of it as well. So that would be my tip, is to try and make that new food as exciting and enticing as possible.
Gosh, they're just like us. It's all about perspective, isn't it?
Right.
On your website, do you have your favorite toys, favorite puzzles, things like that? If you go to your website, do you know what I mean? Do you have anything like that?
So I have some really good downloadable resources, and there's actually a puppy biting resource on there as well. So that's trinityvetbehaviour.com. There's a free resources guide page on there, and you can just download the resources for free. There's some stuff on Kongs and things like that on there as well. So lots of things to find on there for sure.
Okay, cool. So if I reference if I reference you, it's okay to use that for some educational stuff. Okay, that's really good, because there's a lot of stuff out there, but you just have to be careful about where you pick and choose. Yeah, it can be a bit of the Wild West.
Yeah, I know, especially in behavior medicine, right? That's I also have a Facebook group, which is the Pet Behavior Community. So there's also lots of good tips on there, so people can join that group on Facebook. And
so if there's a client with real issues, they can join your Facebook group.
Yeah, they can join the Facebook group and ask questions there, and then we can always direct them onto how they can get a little bit more bespoke and individualized help from us.
That's amazing. I'm definitely going to use that. That's really cool. That's excellent. Well, thank you so much for your time today. I really appreciate it. I know you're busy there. Are you pretty much chock-a-block with behavioral consults on a daily basis?
Behavior consults. Yeah, absolutely. Behavior consults are busy. I do quite a bit of other clinical work as well. I'm quite interested in pain and anesthesia, and then the behavior cases require medical workup. So I do have a foot in both camps, definitely.
Yeah, because our brain is connected to our body, so it's really important to do the medicine first. And that's so true.
Absolutely.
Cool. All right. Well, thank you so much. I really appreciate it. It's nice meeting you. And I'll send you all these links. I'll send you all these links as well. If you want anything, just let me know. I can just send you the raw footage as well.
That would be amazing. And are we okay to use that for our social media as well?
Of course. Yeah, that'd be great.
Super.
Yeah. Alrighty.
Thanks so much.
Thanks.
Nice to meet you, Paul. Bye.
Nice to meet you. Bye.
Bye.